June is Men's Health Month. With safety guidelines being relaxed after the pandemic, many men are now finally able to get into their physician for routine healthcare maintenance, but also address any pressing health concerns they may be having, including any issues with sexual dysfunction. Some research has suggested that COVID-19 has had an impact on men's sexual health, in particular, erectile dysfunction. Today, I will be getting you up to speed with what you need to know about the correlation, so stay tuned. The show today is brought to you by our sponsor, the Prostate Health Academy. The Prostate Health Academy is launching soon, and this is exciting news. The Academy will be an essential community for individuals wanting to learn more about prostate conditions, connect with like-minded individuals, and improve their overall health. So the big question is this: how can men and those who care for them better educate themselves regarding prostate health, the conditions that affect the prostate, and the latest technology in managing these conditions? That is the question, and this podcast will provide the answers. On a weekly basis, we will be chatting with experts, innovators, and leaders in the field of urology, sharing useful information with the general public to improve their lives and increase their overall health. My name is Dr. Garrett Pohlman, and welcome to the Prostate Health Podcast. Prostate Health Podcast is for informational purposes only. Nothing in this podcast should be construed as medical advice. By listening to the podcast, no physician-patient relationship has been formed. For more information and counseling, you must contact your personal physician or urologist with questions about your unique situation. Many men suffer from erectile dysfunction, or ED. ED can be defined as the inability to obtain and maintain an erection adequate for sexual intercourse. Having ED can be a cause for added emotional stress, affect a man's self-confidence, and contribute to relationship problems. There can be many causes of erectile dysfunction. It can even be a sign of an underlying health condition such as heart disease. Some research has found that men who have had COVID-19 might develop sexual and reproductive issues, including erectile dysfunction. At this point, investigators are still unsure of the exact link between COVID-19 and ED, but there are several factors that have been thought to lead to the potential development of ED after COVID-19. We know that good blood flow is required to achieve adequate erections for sexual function. COVID-19 can lead to damage to the body's blood vessels, including potential damage to the fragile blood supply of a man's penis, which can lead to a compromise of the vascular integrity necessary for normal erectile function. Well, how can this damage occur? COVID-19 causes a high level of inflammation in the body, which is the body's defense response. There's a state of hyperinflammation promoted by inflammatory cytokines, which are some of the same inflammatory cytokines which have been associated with progression of sexual dysfunction in men. Not only can inflammation develop in the lining of these small blood vessels, but the inflammation can also cause small blood clots to form, all of which can disrupt blood flow to the penis. There is also evidence suggesting that damage to a man's testicles can occur following COVID-19. Damage can occur to the Leydig cells, which are the cells responsible for testosterone production. Testicular damage may then result in decreased testosterone levels in the body, as this is where the majority of testosterone is produced for men. We do know that low testosterone levels not only contribute to fatigue, decreased sex drive, and muscle mass, but at times also erectile dysfunction. Now, whether this state of low testosterone is permanent or temporary remains an unanswered question so far. With the testicular damage, reproductive health just might also be affected. With that being said, the effect of COVID-19 on male fertility is a topic that still remains widely debated. In a recent review of the literature, it was determined that current data on the effect of COVID-19 on the male reproductive system is currently insufficient, as the studies are based on a small number of patients and therefore are often contradictory. Well, we are going to take a quick time out to thank our sponsor, the Prostate Health Academy. There is some exciting news coming with the Prostate Health Academy. The launch is just around the corner, where we'll be opening the doors to the Academy. This will be an essential community for individuals wanting to dive in even deeper and learn more about the various technologies available to them for prostate conditions. In the Academy, you will be able to interact with like-minded individuals in the private community forum and have access to exclusive bonus podcast after hours video content with experts, innovators, and leaders in the field. We'll also be keeping up with the latest evidence on a prostate healthy diet and exercise, and creating a roadmap for you to keep you on track. For those that don't want to miss out, you can sign up for the waitlist at www.prostatehealthacademy.com. Now lastly, COVID-19 has resulted in an increased psychological burden. It is expected that we will experience increased rates of post-traumatic stress disorder, depression, and anxiety in the general population following the pandemic, and even more so in those who survived COVID-19. Social isolation and the illness itself are both causes of stress. A decline in mental and psychological health can be a potential cause of erectile dysfunction. It has been reported that sexual desire and frequency have declined in both genders during the pandemic, and as we had already mentioned earlier, with a potential decrease in testosterone level from COVID-19, could also lead to worsening in sexual desire and mood. Well, that concludes our brief episode today on the effect of COVID-19 on men's sexual health. Erectile dysfunction can certainly be a good indicator of our overall health and is often a symptom of an underlying health problem. If you're currently struggling with ED, make sure to seek medical attention from your physician who can perform the necessary evaluation as well as discuss treatment options. Thank you again for listening to the Prostate Health Podcast. Follow me on Twitter and Instagram at gpohlmanmd. Don't forget to join us next week for another episode.